Aliyah Bhatia, and I'm the Chief Operating Officer at Vot-ER. At Vot-ER, we create a wide range of programs that allow healthcare organizations to engage their patients on voter registration. This video is about our Touchless offering, where patients can use their own phone to register to vote. The first piece that we want to talk about before diving into the program itself is why, and why now. Our founder, Dr. Alistair Martin, is an emergency doctor in Boston. And right now, every time he goes into work, he has to grab a used N95 mask because of the shortages at his hospital and across the country. COVID-19 has taught us that our ability to respond to the healthcare challenges of the day, like the opioid crisis, natural disasters, and pandemics, are a direct consequence of the policies we create or fail to create to support our healthcare system. It's never been more important than now to help our patients be part of creating those policies and to make a safer and more equitable healthcare system for all. The first step is making sure that our patients get registered to vote. We're honored to welcome you in that effort to join a growing chorus of hospitals, community health centers, and clinics all across the country that are empowering their patients with Vot-ER. What you probably received in the mail was a collection of posters and stickers. And what we want to do in this video is to help you go from that collection of different pieces into a system that helps and supports your patients to register to vote. There's going to be three main steps to keep in mind as we go through this setup. The first one is investing in the human touch. And right now in late March of 2020, that means, of course, without any sort of touching at all because of the interesting moment that we are in. So let's talk about that piece, which is really all about taking what you received in your box and turning it into a system. From what we've learned so far, patients should see or hear a Vot-ER prompt about 5 times in their visit. It's not actually about, do I put the poster up or use the sticker or leave the handouts out? It's how do I do all of these things so that the patient is consistently hearing that this is a priority to their hospital or clinic, which is a group of people that they view as important authority figures in their lives. We ask that you use all the different pieces we've provided together to ensure that each patient sees or hears about Vot-ER about 5 times on their visit. Let's start with seeing a Vot-ER prompt. We'd really love if you put your Vot-ER materials in high traffic areas where it's obvious to patients for them to notice those materials. We've provided a display sign that you can put near your check-in area. And then we've also provided posters that you can hang up near wall plugs, bathrooms, water fountains, near vending machines, near parking ticket payment areas, areas that are high traffic for patients, particularly when they're up and walking around. And so that's the place to start. Let's make sure that patients see a Vot-ER prompt on their patient journey. And even more importantly, we actually need them to hear a Vot-ER prompt. Part of this is going to be creating staff prompts and training your team to nudge patients and then placing different materials in the right places. One thing we've provided you is with stickers, and we recommend you put them in between the staff and the patient at check-in in the front office area. This is a great way for a patient to ask a question or even for a staff member to prompt the patient to think about registering to vote while they wait. What we've also provided are a set of laminated FAQs that the staff can hang on to so that if something comes up that they aren't sure about, they can just look at that FAQ sheet and share their answer with the patient. And then finally, we've sent a set of handouts, which you could put anywhere, and we feel that the best place to provide these handouts is actually as part of the discharge paperwork, because we know that patients take that really seriously when thinking about what they need to do as a result of your conversations with them. We have provided a staff training in the Vot-ER folder so that you can give a sense to each of your staff members of the do's and don'ts of talking about voter registration and how to prompt the staff to speak about voter registration. We have learned a little bit about what works in terms of speaking with our patients. Voter registration is one of those things that many people want to do or have done before, but may not necessarily have done recently. And so what we don't want to do is create stigma around whether they've registered to vote as yet. This language that we've provided gives an opportunity to have this conversation without putting the patient on the spot. So we recommend that you say something like, many people think they are registered to vote, but they're not because they have recently moved or changed their name. Are you registered to vote with your current address and name? This way, you give the opportunity for the patient to maybe admit that they need to change their address or consider the question, but without asking them a yes/no question that could put them on the spot or suggest they haven't done something that maybe they want to do or feel that they should not to have done. There are a bunch of ways that you can go above and beyond, and we've given a list here of different pieces that some of our hospital partners are already doing. Some of them are posting this information on their LCD screens so that those patients that are paying attention to what's on the screen see this message as well. Some are putting in a message in MyChart that goes directly to the patient's phone or to their email. Some are putting a link on their homepage, and you could also just put our short link on your discharge paperwork. We suspect that you are closer to your patients, you know what they need, and you may come up with an innovation we never thought of, and we hope you'll let us know if you do. Step 2, beyond really setting up this system so that patients hear or see Vot-ER 5 times on their visit, is just making sure that your other key stakeholders are informed. What we've done is we have provided a launch email draft to you that one of which your chair can send out or department head, and one of which you can send out to indicate that you're available for any additional questions. We wanted to make sure that we didn't put any extra work on your plate in setting this up. We've also found that a number of PR teams at different clinics and hospitals have been really excited to bring this good news to their local press, and we've had it covered in several of the hospitals where we have Vot-ER. We've provided some talking points about press, in particular how to make sure to speak about Vot-ER and Mass General when sharing information about this with the press. We are also more than happy to help you secure press attention for this work and are happy to partner with you on identifying local press and making the pitch about this story to them. Please let us know if we can help you with that. And the third step is to grow with us. This work looks really different than what it looked like just a month ago, and it will probably look really different in 3 months. And what's going to make it effective is when we hear from you about what is working and isn't working with the patients and communities that you partner with. So please let us know, and we're looking forward to sharing with you what we're seeing in other places as well. When you are all set up, please send us a photo and include your social media handles, and we'll be sure to get it up on our Twitter site and our Instagram site. Our emails are right here, and we look forward to hearing from you when everything is all set and ready to go. Thank you so much. We really appreciate partnering with you and are so excited to go on this journey of ensuring that our patients can have voice in the policies that impact their healthcare systems.